Hi, just give me 1 second. You must be my 3 o'clock? Hi, yes, nice to meet you. Alright. Sorry, we're running a little bit ragged here. Kind of a busy time, you know? Just jump right into it, okay? I'm just gonna take some information down from you and then we'll get started, okay? Alright, in your full name, I need it. Okay, date of birth. Sorry, what was that? Oh, very close to now. Okay, does your family have any history of previous illnesses or no? Okay. And then are you yourself at risk? Do you have any illnesses right now? No. Okay. Great. Are you taking any medication right now? Yes, that counts. Yeah. Alright. And when did your symptoms begin? Okay. Sorry about that. Right there. We kind of have to, hurry it along these days. So I have to get all the important information first, and then we can, get to know the actual patient. My name is Dr. Nia. I don't know if yeah, you know that. Okay. So what brings you in today? I've heard you had some shortness of breathing and you're worried you might have the coronavirus. Okay. Yeah, just tell me about it. What are you feeling? Okay. Yeah, we can definitely administer a test today. I would just like to let you know that we are a little short-staffed and underfunded right now. We're not operating at 100%. We're operating at about 70%, if even that. So I don't have gloves. I don't have a mask. We only have the test. Is that going to be okay? Yes? Okay. I know it pretty much is okay because we're kind of the last option here in the city, but I just like to ask and let people know what they're actually getting in for. We're not the best right now. I promise you, we are actual clinic with actual doctors, and I'm an actual doctor, but right now we're kind of just running in pandemic mode, you know? Yeah. Okay. Alright, I will make this as fast as possible so you can get on your way. Let me just... Alright, first I'm going to check your lymph nodes. So I'm going to check right here. I'm also just going to feel your throat and just make sure that there's no swelling, okay? Okay. I'm going to touch you. My hands are clean. I promise I sanitize them about 5,000 times a day. So I can guarantee you they're clean. Can I touch your face? Okay. Ready? Alright. Can you tilt your jaw up for me just a little bit? Thank you. Alright. Yeah. Alright, and your neck now. I'm just going to touch just right here. Okay? Yeah? Okay. Just, yeah. I definitely feel just a little swelling. I'm not sure if it is actual coronavirus because there are a lot of different symptoms, as we can tell, and it starts a whole variety of different ways. But I can administer the test. Sorry, I'm a little tongue-tied right now. Like I said, we've been working for 24 hours straight. I can't administer I can't administer the test to you, yes. Would you like me to do so? It is a little invasive, but we will have results within around 5 or 10 minutes. Yeah? Okay, let me go get the test. I'll be right back. Alright, so, are you ready? Perfect. So, before we begin, I'm just going to explain a little bit to you what it is. Our tests are a little bit different, as we don't have access to the one singular test, the one that goes up your nose and everything. What I'm going to do is I'm going to administer a couple of different tests just to test your nose, these aren't your nose, your ears, your nose, and then also your throat, just to make sure we can get all of the conclusive results we need to determine if you have coronavirus or not coronavirus. Yes. Yeah. Usually the results turn out to be that it is just a common flu, so you don't have anything to worry about. But we do prescribe some medication for you if it turns out that you do have coronavirus. And then we also give you a recommendation to go to an actual, ER center, and they actually will have a bed waiting for you over there if it is the coronavirus. Yeah. You ready to begin? Perfect. So the whole time I'm just going to be taking notes on the test, and I'm just going to take note of the results of every test so we can be inclusive about results, okay? Oh, I have so many tests in here. We administer, I want to say, about 50 to 75 tests a day. Yeah, it's a lot of work, but we do what we can in this time, right? Here we go. Okay, so the first test, I'm just going to test your hearing and just make sure that there's no blockage in your ears. Yeah, you ready? Cool. Don't worry, I'm going to stick this in your ear, but I'm only going to stick it around that much or so you won't feel a thing. You should hear a thing. If you don't hear anything, just let me know, okay? Okay. You feel that a little bit? Okay. Next side. I'm going to get just a little bit closer to you because I don't feel like I'm administering the test completely, and I want to make 100% sure that I'm doing this right for you. Okay? Alright. There we go. Yeah. Okay. Perfect. Okay. And I'm just going to measure this out. So that is about an inch into your ear. Sorry, I like to talk to myself. If you hear me mumbling on my breath, it's just me doing calculations in my head. Oh yeah, that was perfectly fine. I can't tell you whether the test was good or bad until I look at all the test results together, so yeah. Okay, next one. Okay, now I'm going to test your eyes and just make sure that they're functioning normally. I'm just gonna have you look into this light, okay? Alright. Do you mind if I look in your ears again? I just want to make double sure. Okay. Awesome. Can you say ah for me? Ah. And then just make sure that when you say ah, you're pushing your tongue down. I need to see all the way to the back, yes. Perfect. Yeah, no, that's great. I'm gonna take some notes down, okay? Next test. Okay. Now for this one, I'm going to be testing your breathing functions. I don't have a stethoscope, but I do have another device that I'm going to use. Yes, it's my own personal homemade device, but I am a scientist and a doctor, so I will vouch by it. I think it works pretty well. So what I'm going to do is I'm going to rub some of this cream on your chest here. And it is a very aromatic cream, so you're definitely going to be able to smell it. And then while you breathe, I'm going to have you go breathe in the aromatics. And then I'm going to listen with my own little homemade version of a stethoscope, and I'm just going to listen to your lungs and see how they're functioning right now. Ready? Perfect. To warm it up to get the, you'll start to smell it here soon. Here, maybe I need a little bit more. There we go. As it warms up between my hands, you start to sort of smell the aromatics. Yes, this is the system I created myself. I had to get creative on how to hear someone's lungs without a stethoscope because we ran out of those a couple months back. About a month, I would say. Okay, ready? Stuff is just good to rub on your hands too. It's actually anesthetic, so it kills the germs in my hands. It's sort of like hand sanitizer, but better smelling. Okay. I'm just gonna let that sit and just let it work its magic there. I'm gonna forget these darn things. There we go. Okay. Now I'm going to take my listening device. Now I'm going to place this against your chest, and then I want you to take a couple deep breaths with me, okay? I'll guide you just to do them exactly how I do them, okay? Okay. Okay, ready? Good job. Once again. good. One more. Good, great. Now, this is gonna sound a little strange, but I'm gonna want you to pant for me, okay? Just, okay? Oh, you want me to do it with you? Okay, okay. Just follow with me, okay? You're doing great, keep going. Okay. Perfect. Got all I needed. I'm just gonna make some notes, okay? Goodness gracious. Alright, last test, are you ready? Okay. This test is administered more by these little beads more than me. You see all the work here? They are, we call them guard beads. They're filled with essential oils. And I'm gonna have you eat, oh goodness, I dropped it. I'm gonna have you eat one of these beads. Because the essential oils in these beads, I found they react negatively to certain viruses. Now, what that means is that if you swallow one of these beads and it passes down your throat and it stings, that means there's a virus present that doesn't like the essential oils in these. And I found out that one of those viruses is indeed the coronavirus. Yes, I mean all strands of the coronavirus, yes, react to this, but it also gives me the insight whether it's COVID-19 or just another strand of the coronavirus. I have a couple in here. I could maybe send some home with you. Yeah, you just want to do, I don't recommend self-testing yourself, you know. These are my own preferences and I am a doctor, so I know how to interpret the actual results. But these I found you can give to anyone, and if they feel a burn when they swallow them, then tell them to come see me and I'll give them a full test and we'll get results for them. Okay. You're gonna eat this thing. Yeah, it's very, very tiny. It's like you won't even feel it's like down your throat. Yeah. There you go. In fact, I'll eat one too. How you feeling? Good? Does it burn a little bit? Just a tad. Okay. Let me definitely make a note of that. You know what? While I'm at it, can I take another look at your throat? I just want to make sure. Okay. Alright. Okay. I'm just gonna go talk to a fellow colleague and I'll be right back, okay? Okay. Alright. So I just finished partnering with my colleague and we both have come to the conclusion that you do not have the coronavirus. Yay! Yes, okay, yes, you still do. You still do have a flu. And it's actually a strand of the flu that's a little bit more elevated, so you may be feeling a little bit more in your chest, and maybe feeling a little bit more in your lymph nodes, and you feel like you have a head cold, yeah? Yeah, so that's just another strand of the flu, but fortunately it is not the coronavirus. Yeah. Yes, yes. Congratulations. Yes. Yeah. Okay, so what I'm going to do, I know it's still a very uncomfortable feeling to have the flu, so what I'm going to do is I'm going to give you some more of those little essential oil beads, and you can take some of those home with you. And then I'm also going to give you a behind the ear lymph node massage, just to sort of try to drain all of that stuff that's in there. Yeah. Yeah, and then we'll send you on your way and it'll be good to go. Ready? Okay. Here is the beads, and I'm going to give you 2 this time. There you go. There you go. You just go ahead and swallow that. And then I'll also send you home with one of these things. You just get at the front desk and they'll be happy to give one to you, okay? Alright, now I'm just going to give you a lymph node massage just right here. Just maybe I can give you like one that's like right under your chin too. You're feeling a little bit of pressure there? Yeah. Okay, so I'm just gonna, do you mind if I touch your face? Again, my hands are washed. They're fine. Okay. Let me see here. Yeah, a lot of people say actually this is the most relaxing part. I'm just doing right here. Yeah, I think I'm just gonna do this whole bottom section of your jaw and also a little bit under your neck there. Just kind of work it out like a massage for your face, but just for your lymph nodes to drain. Just gonna do behind your ears too, just right there. Okay. Oh yes, you'll be perfectly fine. This flu usually takes maybe around 2 to 4 days, and I think you're over the hump right now, past the worst part. You tilt your chin up for me. Oh my gosh, you know what? That is a great idea. Yeah, I can use some of the aromatics. One second. I'm only gonna use a little bit because it's right near your face. You don't want your face to smell like this old idea. Alrighty, it looks like you're done. How are you feeling? Happy? Yeah. Happy that you don't have coronavirus. Yeah, understandable. Okay, so I would just, monitor your condition for the next, like I said, 2 to 4 days, and it should be gone by then. If it's not, give me a call and we'll look you over again, okay? Okay. Well, it was very nice meeting you. I hope you have a great rest of your day.